is a natural element in water. In fact, locally at Guy's Mills, there's a bit of natural fluoride in the water that those kids that come into the dental office have fewer cavities than a lot of the other kids. But what the fluoride does is it binds in the enamel, makes it much stronger. It doesn't make the enamel thicker, but makes it denser and less permeable to decay and sugar, sours, bacteria breakdown. So it makes the enamel denser and stronger.
It makes your teeth strong and healthy.
Exactly. Fluoride doesn't make your teeth clean. Fluoride doesn't make your teeth shiny. Fluoride helps make your teeth healthy because it makes them stronger.
While children are young and their teeth are growing under the gums, fluoride that is swallowed enters the bloodstream and goes to the jawbones. There, it combines with calcium and phosphate as they come together to form the hard enamel of the teeth. These teeth are more resistant to decay throughout childhood and the teenage years.
Ever since the 1940s, fluoride has been artificially added to drinking water to help fight tooth decay. It's been credited with reducing cavities by up to 50%.
I remember when I was a child in school and fluoride was really just coming on the forefront. That would have been the mid-50s. The commercials on television were two classrooms of children, and there was the controlled group that received fluoride as they were developing and the group that did not. And it was always the kids in the group with the fluoride that could hold up the card and say, "Look, Ma, no cavities." And the dental commercials, "Look, Ma, no cavities." And they can directly attribute that to the benefits of fluoride. So I think we would be very fortunate in this area to be able to have fluoride in our water.
You take a raw egg and coat the shell of it with topical fluoride like you would receive at the dental office and let it dry on there. And then take another raw egg in the shell and put them both in a thing of vinegar, which simulates the acid that happens in the mouth. The fluoride egg stays hard much longer than the other. At the end of the day, the egg that didn't have the fluoride on the shell is just like a rubber ball, and it's very impressive, and it's very visual for the kids, and they really get it. The one that has the fluoride, eventually it kind of breaks down too, but there certainly is a difference, and it's a dramatic example of how fluoride works in the teeth.
Feel the difference? Which one had the fluoride on it?
That one.
Which one? Why do you think that?
Because this one feels...
Why? Why do you think?
Because that one's more like weaker. This one we could bounce off the floor.
Yeah, do you think that your teeth would be very resistant to decay if they were soft like that?
No.
No, but how about this one? This one's a little stronger.
Fluoride in the water is such a beneficial thing right from the time a child is born, as they start to form teeth. Even as an adult, you know, a tiny bit of fluoride helps strengthen the tooth enamel of the teeth that's in your mouth.
Now, when you have a small child in the chair who doesn't have basically the benefit of fluoride in the water, there's a lot of problems going on locally. And what people don't realize is 50% of the general population, whether they have dental insurance or not, see a dentist on a regular basis. So that's 50% that aren't coming into our offices. And that's where the fluoride in the water would help these kids who can't afford to come in, who don't have the time to come in. They get the fluoride benefits.
You know, occasionally you'll find a child who has no teeth when they come to school, and that's difficult for speech and eating and whatnot. It's difficult for the children in the classroom too, because they can't express themselves or the other students don't understand them, and so it kind of puts them in a little bit of a disadvantage for school learning and socialization too. The fluoride tablet program has been available to Crawford Central School students since I started I started with the district in 1985, and it was probably within a year that it was implemented with the district. Now the fluoride tablet, the school dental health consultant writes a prescription for that. All of the students, kindergarten through 6th grades, are eligible to participate in the program.
The only downside with that is compliance, if the kids will take it every night before they go to bed, and what do you do during the summer months when they don't have school?
The state requires that children have dental screenings a couple different times during their school career, and once they do have that screening, their dentist, if they have one, receive a report, and the kids are referred to their family dentist. And in a lot of cases, these kids just don't have anyone to go back to, and so the problem goes unchecked, and consequently we end up seeing them later on as either in the emergency room or some other type of healthcare facility.
Dental pain or dental complaints are usually one of the top 5 emergency room complaints that we see here at Meadville Emergency Room. It's usually within the top 5. Sometimes it's #1 diagnosis, and so we have a lot of people in this community with poor dentition. And when we see those patients, one of the things we're trying to discern is whether that person may have a dental infection or a dental abscess. So it's important for us to do a thorough evaluation of those patients.
The 2010, 11, and kind of wrapped up with prioritizing in 2012, the needs assessment that was done, clearly came out at the top of the list was the need for improved dental health, oral health. One of the interesting facts I think that people are surprised whenever I tell them about this is in a 3-year span, 2 times out of the 3 years, the most common reason for a person to go to the emergency department at Meadville Medical Center was for oral pain, was for dental problems. And the other year it was second. So in recent years, the number of times people go to the emergency room, the most common reason, which still kind of blows me away thinking about it, is for dental problems. You would think it would be heart attacks. You'd think it'd be stroke or pulmonary problems or even digestive problems. But dental pain is what puts people in the emergency room at Meadville Medical Center.
Well, the dental clinic was kind of a priority or goal when I came onto the board to at least investigate, research what would it take to put a clinic together. As I said before, a lot of the students in Crawford Central School District, where the Meadville Medical Center is and where the clinic is, really didn't have good access to a clinic.
The dental center is seeing about 400 people a month now. It's been running since July of 2012.
We see just big numbers of families, both children and adults, going to the clinic.
The dental center itself isn't going to be able to solve the problem long term. If it had been there 10 years ago, we would still have folks who aren't practicing preventive care, I believe, and are going to end up with dental problems still down the road. I think the best solution to that is an upstream solution where we have fluoridation program in the Meadville water system.
When it's in the water, it's very easily accessed. I mean, you drink your water every day. We have excellent water in Meadville. It's a good quality water.
Including fluoride in the water supply would be optimal for students and adults alike, because every time they take a drink of water or wash food or something, they get a little tiny bit of fluoride, and that helps strengthen the teeth as they're in the mouth and also as they grow in their mouth.
Fluoride works best when small amounts are available throughout the day to heal the teeth whenever and wherever decay is beginning.
Hundreds of dollars at least for just about any visit. And once you start talking about giving IV pain injections and IV antibiotics and imaging such as CAT scans, it can get into the thousands of dollars. So absolutely, fluoride supplementation is a great cost benefit to that. And if you can get people to take care of their teeth, you can save a lot of money.
I get excited when I see an Allegheny kid in here, maybe on a minor athletic injury or a wisdom tooth giving them a problem. But I get excited when I see beautiful teeth, no fillings, none, Zippo. And without even looking at their health history, I can say, are you from Pittsburgh? Are you from Philadelphia? Are you from Cleveland? And I'll say, yeah, how'd you know that? You had fluoride in your water. And it makes a big, big difference.
In the long run, a lot of the laws and a lot of the things that happen in this country are beneficial to the majority of the people.
People often wonder, if you put fluoride in the water and you reduce cavities, we hurting ourselves financially? Aren't the dentists putting themselves out of business? And the answer is yes. We are trying to put ourselves out of business. Can you imagine putting something in the water that cures diabetes? They do it tomorrow. Something in the water that cures obesity. They do it tomorrow. How about heart disease? These big heavy hitters that people in the baby boomers are going to be affected by as they get older. And the answer is, with only 50% of the population seeing a dentist on a regular basis, there's still another 50% out there that need our care.
My answer to someone who's concerned about the addition of fluoride to the water is, yes, people should be taking care of themselves. But our population around Meadville, in many cases, isn't able to, so it becomes a cost on everyone to treat them in the emergency room. That's probably the worst way to deal with someone's dental health, is to treat them in the emergency room for pain. You treat the pain, the problem didn't go away, the problem's still there. If we can prevent those problems in the first place, then we're never going to have the pain and the suffering.
Some of the literature and some of the physicians, dentists that I talked to, some parents were concerned about overdosing, like taking too many fluoride tablets at one time. And then they should be concerned. I mean, you don't want to ever take too many medications. But you would actually have to drink a bathtub full of water at one time before you would have any effect from the fluoride in the water. And that's just not physically possible.
You know, some of the reasons to oppose fluoridation don't make a lot of sense to me. One of the things says fluoride is the only chemical added to the water for the purpose of medical treatment. Well, I don't think I agree with that, because I know that there's chlorine in water, and the reason it's there is to prevent some bacterial diseases that are born in the water. And I think that if we could combat something with chlorine, we can combat dental caries with fluoride, because it does strengthen the teeth.
If you're concerned about your kid's health, and if you're concerned about the new babies and the community, and all about wellness in your community, then you'll be supportive of a fluoridation program.
It's the same as putting iodine in salt. It's the same as putting vitamin D in milk. It's the same as putting vitamin C in orange juice. It's all health oriented. And I think what people in Meadville have to realize is Cambridge Springs has it, Erie has it, I believe Oil City Franklin has it, and then your major areas like Pittsburgh, Philadelphia, Harrisburg. Meadville needs it. We need to get in the new century and help out these kids, because in 10 years, you're going to see a big improvement, phenomenal improvement. These kids are going to be graduating from high school without having a cavity at all.
That little tiny 1 drop of fluoride per million drops of water, you can't see it, you can't taste it, but it's always there doing its job. And when you find children, they're like, oh, we hate the taste of this stuff. I'm like, well, someday maybe you'll be on city council and you can help do something about changing that. So that's our wish. We only want to see the dental health in this area improve.